Welcome to this episode of Absolute Talks. I'm here with Conrad Rensberg, and today we're going to be discussing removables in the 21st century.
Oh yeah. And I think the starting point of any new concept is it's got to be the same. And what I mean by that is clinical workflow has to be predictable.
Right.
It's got to be the same thing that our clinicians are
They're
used
not
to.
learning something new.
Exactly. And then strength, aesthetics, and cost needs to be comparable. We can't just charge double for a denture because we say it's better.
Right.
Now, one of the biggest advantages we have is we don't rely on a bite room, a wax bite room to set the video. That's probably the toughest thing for anybody to do. I think clinicians and technicians all agree that nobody likes to start from scratch. With the new workflow, we can basically take an existing denture, wash, reline it with some light body, reset the border molds, take a few pictures of that patient, and then digitally scan that denture.
Nice.
Put it back in the mouth, scan the opposing, and send that file to us. So with me, you can be anywhere in the country and do removable denture work with us.
Very nice.
Very efficient. What we do then is we take that data and we'll basically diagnostic wax it, same as we do with Crown and Bridge. That also means that we now have a digital archive, and we'll talk about that in just a little bit.
Right.
We'll send you those pictures. You can actually show to the patient what we're suggesting, and then we go straight to final, which means we can do denture work in as little as 2 clinical appointments, one for impressions and record taking, and then one for final delivery.
Oh, that's incredible.
Huge advantage over traditional denture work.
Well, why don't you tell me a little bit more about the digital archiving?
So digital archiving allows us the ability to recover if the patient loses their denture. Up to this point, when the patient loses their denture, the clinician has to do another 3 or 4 clinical appointments, record taking, tooth try-ins, and then
Start
processing.
over.
A lot of things can go wrong, and nobody really makes any money. Right now, you pick up the phone and say, patient name, case number, and within 24 hours, we have a brand new denture to you.
Oh, that's incredible.
No clinical chair time. And then I think the biggest advantage is strength. Everybody knows Lucitone 199. It's been on the market for years. Everybody trusts the material. The advantage with printed Lucitone is actually 3 times stronger than traditionally processed.
Oh, that's incredible.
You'll have a shade guide in your hand.
It comes in 5 shades.
5 shades, yep. And if you let us know through absolutedentallab.com, we'll send you one of those.
Absolutely.
A lot of advantages. I think it's definitely something of the future. Never thought we would say this, but there's so many advantages. We can even do a new denture turnaround digitally in 24 hours.
So easy workflow, strength, and aesthetics?
All in the same package.
Yeah, that's great.
We're excited to do the next case with you. So wherever you are in the country, let us know and we'll take care of you.
Thank you for joining us on this episode of Absolute Talks.